Thank you, Peter. Peter talked a lot about the framework itself, the reporting platform, and I would like to use the last 5 to 7 minutes of our presentation to talk about the process. Because when Rachel Taylor invited us to be part of this forum, she said, please emphasize or please explain to us what the process was by which you developed that framework and also interacted with so many stakeholders in this initiative. So when we started out, actually, there was not much process in place. So actually, you see there a lot of blank spaces within the timeline. We had 2 major milestones set up for the BU team, which was creating that framework and reporting platform that Peter talked about. And at the end of the first year, creating a first-year report. But much of the process wasn't really in place. And the process was developed kind of stepwise as we were going through that, incremental, if you want. Even though there were the principles that Peter talked about, the guiding principles that were in place right from the start, from our proposal onwards. But the interaction with particularly the metrics group that Danielle mentioned, which was our first point of contact with the Access Accelerated, where we were reporting our progress to. And then we had kind of 2 points during developing that measurement framework and reporting platform in which we received feedback, formal feedback from companies, from the World Bank, from UICC. That was happening after 5 months of the project, where we described what we had developed and we took in feedback from the companies. Particularly that feedback helped us to clarify terminology, clarify descriptions. And then we had another major milestone, which was the training, in which we again received feedback on the registration forms that we developed in order to report into the Access Observatory, and the same with the reporting form. So where we received feedback, and that helped us to clarify. I believe probably one of the most interesting points to talk about when we talk about the process is probably the tensions that occurred during working with these multiple entities. And I say tensions as opportunities and challenges, not necessarily as negative. Sometimes we see, I think, tensions as something negative. And I always think they give us a lot of opportunity and also challenges, and these challenges help us to strengthen our interaction, so to speak. One point to mention is that on this slide, I put the extreme, let's say, one point of the tension point on the right and one on the left. It's not to say that one actor always was on the right or one actor on the left. I believe actually that actors sometimes had inherent in them these 2 poles, and I will make that clear with my description of some of these tensions. For instance, the commercial and the social aims. Actually, the programs that we are talking about often have commercial and social aims at the same time. So managing that tension, and that tension was very explicit in some of our trainings. Companies were asking us, why should we actually measure social aims of our programs? What would that help us with? Then the next kind of tension that occurred was probably a tension that was very much in our team between practicality and rigor. As Peter mentioned, when developing these metrics, we were focusing on what is still practical, but at the same time, when we want to demonstrate attribution, we want to show an effect of a program, we need to make sure that we have certain rigor in place. And then confidentiality and transparency, obviously a key tension in the pharmaceutical sector in general, but because of the regulations that are in place, even though a pharmaceutical company might want to report on some issues, it might not be able to do so due to regulations. Similarly, at the BU side, not necessarily due to regulation, but due to, I would say, a tradition. We had a lengthy talk with our lawyer, BU lawyer, could we make this master agreement public? There was nothing which were kind of holding that back, but it was the way in which BU usually handles these master service agreement, not making them public, and we had to kind of overcome that tension with him through our talk. And one critical point, I think, that came through already as a theme in various of the panels that we had today was this developing of a shared language, that it's so important when we have tensions, for instance, having a communication in place that enables us to come to an agreement on certain things. And I believe language is a very, very important point to do so. In order to develop the language, we had to listen very carefully. The others had also listened carefully to us. We had to understand the different uses of languages, and we had this already in our first panel today when Steve Davis mentioned the kind of being able to understand the language in different sectors and having people to being capable of doing so. So we went through a collective process in developing that language, that terminology, coming up then with agreement on certain concepts. One was, for instance, patient journey. Some of the companies came to us and said, we use the term patient journey. We had to understand what does this mean and translate that and find an adequate place for that concept in our framework. And then the last thing, or the last two slides, I would like to tie back what we have worked on in our work with Access Accelerated to what Michael Reich presented in the morning. He presented us with two key dimensions of governance, the transparency and accountability. What I have done is using the same matrix and placing different activities that we have done for the Access Accelerated initiative in this matrix. And as you can see, and it comes from our task. We were tasked to develop a measurement framework and a reporting platform that plays a role in the transparency dimension. Actually, the part of the accountability is less populated, and I put actually question marks because this is a part that I believe is really a part that needs to be worked on. That is important because measurement for the measurement's sake is not what we want. We want measurement to result in actionable progress in strategies in making these programs better. And this is, I believe, a critical part. And I hope we have some time now at the end in this session to receive some feedback. How could that be done? What are the next steps? Who are the actors in place? Certainly, it's not academia who is there in the driver's seat. I put there other agencies that should be in the driver's seat to strengthen accountability. And then the final point, I believe, and we had lengthy discussions in our BU team about this, that yes, this measurement requires commitment, and it cannot only be the pharmaceutical industry or the private sector in general. It needs to be a broader commitment of the global health community, I believe, to feed into that mission for better measurement. So public investment in that together with other agencies, which then would lead to something, not only transparency and accountability, but that shared learning. And Peter brought this up in saying, in kind of looking broad across these programs, what can we learn? How can we really make these programs better and stronger? Thank you.